This Focus on Health segment is brought to you by Aurora Health Care.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Behavioral Health Center. We're going to be sitting down with psychotherapist Gregg Brewer. We're going to be talking about what you should be looking for in your kids when it comes to attention disorders. Well, thank you for joining us today. We're talking about attention disorders in kids, and I guess today we want to focus a little bit on ADHD, and let's just kind of talk about what is ADHD.
Sure. ADHD is a acronym for Attention Deficit Hyperactivity Disorder, and there's usually a couple areas that are looked at. One is what's called an inattentive type, which is usually a child or adolescent, or it can be an adult also, that just has trouble focusing, staying on task, may move from one task to another. And then there's the hyperactive type where you see the squirming, the difficulty staying in one place, not being able to focus also. So you have an inattentive type and then you have kind of a combined type which has both pieces to it.
Yeah, it seems like there are more and more cases, or it seems to be a growing problem. Is that necessarily the case?
Well, in the sense that it's being diagnosed more, that is clearly the case. The CDC just compared some data from 2003-4 to 11-12, and there was about a 42% increase in the amount of parents who reported their child had been diagnosed with ADD or ADHD. Very significant. So that number comes out to about 6.5 million children and adolescents at that time being diagnosed.
Yeah. Do you have an idea of why that number is growing?
Sure. Usually when these things happen, when you have an increase in diagnosis, there's both a good side and maybe a little concerning side. One is that people are just better educated, educators, schools, parents, primary care providers, pediatricians, and so forth. So there's just a better understanding of how this type of behavior plays out, whether it's in the classroom, the home, other places. And so we're seeing it more. Also better diagnostic tools, better screening tools, things like that are used. On the flip side, usually there's a concern about overdiagnosing. The symptoms of inattentiveness and hyperactivity can really be the symptoms of other disorders, physical disorders, mental health disorders, and so forth. And especially in a school-age child who's struggling, there can be a propensity just to say, well, it must be inattentiveness since it's being diagnosed more. So it's important to get a good evaluation and diagnosis.
What should parents or teachers start to look for before there are signals that say, you know what, we need to find some help?
Sure. I think what you'll find at school is some of the behaviors I mentioned. Not being, from the inattentive side, not being able to focus on the teacher, not being able to stay focused on a task for a sustained period of time. So you'd see it academically. From the hyperactivity side, you may see more behavioral issues. They're playing around with their other students, they're throwing things, they're squirming around, they just can't stay in one place. At home, you'll see some of the more hyperactive behavior too. They may be a little more defiant, may not want to do things that you said. But I think if you start seeing any of those things that's concerning you, then it's time to start getting an evaluation done.
Yeah, I would imagine, like you talked about it being overdiagnosed or misdiagnosed, it's important to seek out professional help if you think your child is having these issues.
Absolutely, and I think the first thing to do is always start with your primary care provider, whether it's a nurse practitioner, pediatrician, family practice doc. Rule out any medical issues. I mean, if you think of just inattentiveness, there could be an issue of having slight seizures if they're spacing out or zoning out. So always want to check out the medical first. If there aren't any issues there, then it's good to sit down with a behavioral health provider who's going to gather information from the home setting, from the child, and from the school setting. ADD, ADHD do not go off and on. So if you have it in one setting, you're going to have it in another setting. So they're going to gather information, again, using different rating scales. And then you want to do a good history. There's clearly a genetic component to this, so you want to find out from parents, what was school like for you? Did you space out? Were you bored? Did you have trouble sitting still? If there is that case, it's going to lend some information to the diagnosis. And you certainly also want to look for other things. Inattentive, hyperactive symptoms could be signs of depression, anxiety, trauma, which is something we really want to, as mental health professionals, look at. So you really need to look at it from all angles, and if by combining all that information, then I think you're going to get the best diagnosis.
Yeah, and if you are diagnosed with ADHD, what are some of the treatment options available?
Sure. really want to do three things. One is you want to get some good education to everybody, meaning the parents, helping them understand what the illness is about, helping them know some do's and don'ts in terms of working with their kids. Schools, if needed, you want to get them some information, but they tend to be really experts at working with children with these issues. And then you're looking at possibly medication treatment. Most children and early adolescents are treated with some stimulant medication, which again sounds kind of goofy. Why would you give something that speeds somebody up who's already pretty sped up? But in children with ADHD, and again, as I mentioned, younger children, it does slow the process down, helps them more focused, helps them monitor their behavior better. So there are medication treatment, and then through a mental health specialist doing some individual and family therapy. Things that, again, can help parents respond best to the child, help the child learn some tools to monitor their own behavior and stay focused and so forth. Really a collaborative effort.
Okay, well, we appreciate you taking some time with us today.
You're very welcome. Thanks for your time.
If you have any questions regarding attention disorders, you can contact your primary care provider or give us a call here at the Aurora Behavioral Health Center at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Health Care.